Question 1. Topic: Pulmonology and respiratory emergencies. A 56-year-old male with a history of cough and smoking presents to the emergency department with increasing shortness of breath, wheezing, and productive cough for the past 3 days. His oxygen saturation is 88% en room air and he has pursed lip breathing. Arterial blood gas analysis shows pH 7.28, POCO 55 m8G, Power 50 mSh, 30 Meckel. Which of the following is the most appropriate next step in management? A. Initiate non-invasive positive pressure ventilation (NIV) and administer bronchodilators. B. Immediately intubate and mechanically ventilate the patient. C. Administer 100% oxygen via face mask. D. Prescribe oral steroids and discharge the patient. Answer: A. Initiate non-invasive positive pressure ventilation (NIV) and administer bronchodilators. Explanation: this patient is experiencing an acute cough exacerbation with respiratory acidosis, low pH, elevated POCO, and compensatory. Non-invasive ventilation (e.g. BiPAP) helps reduce co-retention and work of breathing. Giving high-flow oxygen 100% can worsen hypocapnia in cough patients, reducing their hypoxic drive. Intubation is reserved for cases where NIP fails. Question 2. Pathophysiology and disease processes, neurological disorders. Scenario-based. Dr. Patel is treating 64-year-old patient Mr. Rodriguez, who arrives at the emergency department with sudden right-sided weakness, slurred speech, and facial drooping. The physician orders an immediate CT scan and determines that the patient is experiencing an ischemic stroke. Mr. Rodriguez's medical history includes hypertension and fibrillation. Which intervention is most appropriate for this patient, considering the timing of symptom onset? A. Administering aspirin immediately to reduce clot formation. B. Administering tissue plasminogen activator (EPA) if the stroke occurred within the last 4.5 hours. C. Performing an immediate craniotomy to relieve intracranial pressure. D. Prescribing antihypertensive medication to lower blood pressure immediately. Answer: B. Administering tissue plasminogen activator (TPA) if the stroke occurred within the last 4.5 hours. Explanation: ischemic stroke is caused by a blockage in a cerebral artery requiring rapid clot dissolution to restore blood flow. EPA, tissue plasminogen activator, is the gold standard treatment if administered within 4.5 hours of symptom onset to break down clots. Aspirin, option A, is used for long-term stroke prevention but does not dissolve existing clots. Craniotomy, option C, is appropriate for hemorrhagic strokes or severe brain swelling, not ischemic strokes. Antihypertensive therapy, option D, should be used cautiously. Excessively lowering BP may worsen brain perfusion in acute stroke. Relevant guidelines. American Stroke Association (ASA) guidelines emphasize the use of TPA within 4.5 hours. NIS stroke scale. NIS is used to assess stroke severity. Question 3. Pharmacology for Scribe's adverse drug reactions and drug interactions. A patient being treated for major depressive disorder with fluoxetine Prozac is prescribed tramadol for postoperative pain following knee surgery. Shortly after taking both medications, the patient experiences confusion, rapid heart rate, muscle stiffness, and a high fever. What is the most likely cause of these symptoms? Opioid withdrawal due to tramadol use. B. An allergic reaction to fluoxetine. C. Serotonin syndrome due to drug interaction between fluoxetine and tramadol. D. Acute kidney injury caused by excessive medication intake. Answer: C. Serotonin syndrome due to drug interaction between fluoxetine and tramadol. Explanation: serotonin syndrome occurs when medications that increase serotonin levels, e.g. SRS like fluoxetine and opioids like tramadol, are taken together, causing excessive serotonin activity in the nervous system. Symptoms include hypothermia, confusion, autonomic instability, muscle rigidity, and hyperreflexia. Option was opioid withdrawal would present with sweating, agitation, and diarrhea, not high fever and rigidity. Option B, allergic reaction, would present with rash and anaphylaxis, not neurological symptoms. Option D, acute kidney injury, may cause fatigue and electrolyte imbalances, but not the hyperexcitable neuromuscular symptoms seen here. Relevant guidelines. FDA black box warning: avoid combining SRS and serotonergic opioids like tramadol. Management: immediate discontinuation of serotonergic drugs and supportive aromatase, benzodiazepines. Cooling measures. Question 4. Topic: Medical documentation and electronic health records. A 45-year-old male patient presents to the emergency department complaining of severe chest pain radiating to his left arm. The attending physician instructs you, as the scribe, to document the patient's history, physical examination findings, and medical decision-making. While entering the data into the electronic health record, you notice that another record with similar symptoms is open in the system. In a rush to complete the chart, you accidentally enter the new patient's details into the wrong record. Which of the following is the most appropriate action you should take immediately upon recognizing the error? A. Edit the incorrect entry without notifying anyone and proceed with the correct documentation. B. Report the mistake to the attending physician and follow the facility's protocol for correcting errors in the ER. C. Delete the incorrect entry entirely and rewrite the documentation in the correct patient's chart. D. Leave the incorrect entry as it is, since only minor details were entered incorrectly. Answer. B. Report the mistake to the attending physician and follow the facility's protocol for correcting errors in the ER. Explanation. Under HIPAA and legal documentation standards, any error in a medical record should be corrected following institutional protocols, usually involving an addendum or error correction note rather than deletion or silent correction. Deleting entries entirely, option C, can be seen as an attempt to conceal a mistake, could have legal implications. Leaving the incorrect entry and change to option D could lead to serious medical errors if the incorrect documentation influences clinical decisions. Making silent edits, option A, without notifying anyone violates documentation integrity. Proper error reporting ensures transparency, compliance, and patient safety. Question 5. Topic: Pathophysiology and disease processes. A physician is evaluating a patient with a suspected stroke. The patient exhibits right-sided hemiparesis, slurred speech, and difficulty understanding verbal instructions. The physician asks you to document the findings and mentions that the stroke is most likely affecting a specific part of the brain. Which artery is most likely involved in this patient's stroke based on the symptoms? A. Anterior cerebral artery. B. Middle cerebral artery (MCI). C. Posterior cerebral artery (PCA). D. Vertebrobasilar artery. Answer. B. Middle cerebral artery (MCI). Explanation. The middle cerebral artery (MCI) supplies blood to the lateral aspect of the cerebral cortex, including the motor and sensory cortices related to the upper limbs and face, as well as Broca's and Wernicke's areas, which are responsible for speech and comprehension. Stroke affecting the MCI can result in contralateral hemiparesis, weakness, facial droop, and aphasia, speech difficulty, depending on whether the dominant hemisphere is involved. Stroke, option A, typically causes leg weakness rather than arm weakness. PCA stroke, option C, often affects vision rather than motor function. Vertebrobasilar strokes, option D, can lead to dizziness, balance issues, and cranial nerve deficits rather than limb weakness and speech deficits. Question 6. Scenario-based. Topic: Healthcare laws, ethics, and compliance. Dr. Patel is a busy emergency room physician working with you, a medical scribe, during a high-volume shift. A patient arrives unconscious, requiring immediate resuscitation. There is no known medical history available and no family members are present. After stabilization, Dr. Patel tells you to write in a medical record that the patient has a do not resuscitate in order to avoid unnecessary future interventions. However, there is no formal documentation of Apprentice in the hospital records. As a scribe, what should you do in this situation? A. Follow the physician's instructions and document the DNR status as requested. B. Refuse to document anything without a formal DNR order, as adding such an entry without proof could be considered fraud. C. Document that the physician stated the patient has AOIDA without verifying its authenticity. D. Report the situation to hospital compliance officers before making any entry about Apprentice. Answer. B. Refuse to document anything without a formal DNR order, as adding such an entry without proof could be considered fraud. Explanation. Medical scribes are bound by ethical and legal documentation standards to ensure the accuracy of the medical record. Without a legally documented DNR order, falsely recording such an entry can lead to fraudulent documentation and legal consequences. Obstacle allowing the physician's request is unethical and illegal. Option C. Documenting an unverified claim still leads to false documentation. Option D. Reporting the issue might be necessary but should follow institutional procedures for resolving documentation conflicts. Question 7. Topic: Pharmacology for scribes. Which of the following drug interactions is most dangerous and requires immediate reporting to the physician before prescribing? A. Warfarin and aspirin. B. Metformin and lisinopril. C. Ibuprofen and acetaminophen. D. Amoxicillin and pseudoephedrine. Answer: A. Warfarin and aspirin. Explanation: Warfarin is an anticoagulant that inhibits vitamin K-dependent clotting factors, while aspirin is an antiplatelet agent. Taking both together significantly increases the risk of serious bleeding events including intracranial hemorrhage and gastrointestinal bleeding. Metformin and lisinopril. Option B. It can increase the risk of lactic acidosis but is not as immediately life-threatening. Ibuprofen and acetaminophen. Option C. Are commonly used together with caution for pain relief, though excessive use can lead to liver or kidney damage. Amoxicillin and pseudoephedrine. Option D. Do not have a severe interaction. Question 8. Topic: Emergency room and specialty scribing. A patient arrives in the ER with severe dyspnea, pink frothy sputum, and bilateral lung crackles on auscultation. The physician diagnoses acute pulmonary edema and orders an intravenous loop diuretic. Which of the following medications is the most appropriate first-line treatment? A. Hydrochlorothiazide. B. Furosemide. C. Spironolactone. D. Mannitol. Answer: B. Furosemide. Explanation: Furosemide is a loop diuretic that rapidly reduces fluid overload in acute pulmonary edema, relieving symptoms by decreasing preload and pulmonary congestion. Hydrochlorothiazide. Option A is a thiazide diuretic, which is not potent enough for emergency treatment. Spironolactone. Option C is a potassium-sparing diuretic used for chronic heart failure rather than acute pulmonary edema. Mannitol. Option D is an osmotic diuretic mainly used to reduce intracranial pressure, not for pulmonary edema. Question 9. Topic: Medical terminology and abbreviations. A 58-year-old female patient with a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus presents to the clinic for a routine follow-up. The physician dictates the following statement for you to document in the electronic health record. Air. Patient presents for a routine follow-up. She denies EP, sob do or eerder EP today is 14288 mHg. Recommend continuing lisinopril 10 mg per daily and atorvastatin 40 mg OHS. EC remains stable at 6.8%. Which of the following correctly expands the abbreviations in the note? A. CP chronic pain sob, shortness of breath, DO dyspnea on exercise PND, postural nasal drip, BP blood pressure popo kit chest every half second, AC average blood sugar level. B. CP chest pain sob, shortness of breath, DO dyspnea on exertion PND, paroxysmal nocturnal dyspnea, BP blood pressure po by mouth coo at chest every night at bedtime. AC hemoglobin AC EC. Chronic pulmonary sob, severe oxygen blockage, DO dyspnea on examination PND, paroxysmal nerve dysfunction BP body pressure po per or chest every hour at sunrise AC anemia level 1. D. CP chest palpitations sob, severe oxygen breakdown, DO dyspnea over effort PND, paroxysmal nerve dysfunction BP blood pulse po partial or chest quarter hourly AC at carbon level. Answer: B. CP chest pain sob, shortness of breath, DO dyspnea on exertion PND, paroxysmal nocturnal dyspnea BP blood pressure po by mouth QHS every night at bedtime AC hemoglobin AC. Explanation: Understanding medical abbreviations is crucial for accurate documentation. These abbreviations are standardized in clinical practice, ensuring efficient and clear communication between healthcare professionals. Question 10. Topic: Anatomy and physiology. The attending physician dictates the following. With the patient presence with pain localized to the right lower quadrant or RU of the abdomen, nausea and fever, physical examination reveals rebound tenderness and a positive Rossing sign. The working diagnosis is acute appendicitis, and we will order CT abdomen and pelvis with contrast for confirmation which anatomical structure is primarily affected. This condition and what embryological origin does it derive from? A. Gallbladder derived from the foregut. B. Appendix derived from the midgut. C. Descending colon derived from the hindgut. D. Pancreas derived from the foregut. Answer: B. Appendix derived from the midgut. Explanation: The appendix is a vestigial structure located at the base of the cecum in the right lower quadrant RLU. It is derived from the midgut, which gives rise to the small intestine, cecum, appendix, ascending colon, and proximal transverse colon. Question 11. Topic: Pharmacology for scribes. A 65-year-old male patient with atrial fibrillation is prescribed warfarin. The physician asks you to document patient education instructions regarding dietary restrictions. Which of the following statements should be included in the patient education note? A. Increase your intake of leafy green vegetables to enhance warfarin's effectiveness. B. Avoid excessive intake of foods high in vitamin K, such as spinach and kale, as they may counteract warfarin's effect. C. You should take warfarin on an empty stomach for better absorption. D. Discontinue warfarin immediately if you experience mild bruising or nosebleeds. Answer: B. Avoid excessive intake of foods high in vitamin K, such as spinach and kale, as they may counteract warfarin's effect. Explanation: warfarin is vitamin K antagonist. Excessive vitamin K intake can reduce its anticoagulant effect, increasing the risk of thrombosis. Patients should maintain consistent dietary vitamin K intake to avoid fluctuations in inner international normalized ratio. Question 12. Topic: Common medical conditions. A diabetic patient presents to the emergency department with altered mental status, dehydration, and small respirations. The blood glucose level is 504 mdl, and arterial blood gas above shows EH 7.1, bicarbonate 10 mecl, and an anion gap of 24. Which condition is most likely? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hypoglycemic state HS. C. Lactic acidosis. D. Sepsis-induced metabolic acidosis. Answer: A. Diabetic ketoacidosis, DKA. Explanation: DKA presents with hypoglycemia, metabolic acidosis, ketonemia, and high anion gap. Small respirations, deep rapid breathing are a compensatory mechanism to exhale and correct acidosis. Question 13. Topic: Neurology and stroke recognition. A 70-year-old male presents to the ER with left-sided weakness and slurred speech. The physician suspects a stroke and orders a non-contrast CT scan. What is the primary purpose of ordering a non-contrast CT scan in this case? A. To confirm an ischemic stroke. B. To rule out hemorrhagic stroke. C. To determine the location of a brain tumor. D. To detect carotid artery stenosis. Answer: B. To rule out hemorrhagic stroke. Explanation: a non-contrast CT scan is the first-line imaging study in suspected stroke cases because it can quickly identify a hemorrhagic stroke, which requires different management than an ischemic stroke. Question 14. Topic: Cardiology and ECG interpretation. A patient is admitted with palpitations and dizziness. The ECG shows an irregular rhythm with no distinct P waves. Which arrhythmia is most likely? A. Atrial fibrillation. B. Ventricular tachycardia. C. Atrial flutter. D. Sinus bradycardia. Correct answer: A. Atrial fibrillation. Explanation: atrial fibrillation is characterized by an irregular rhythm with absent P waves, commonly causing stroke risk and requiring anticoagulation therapy. Question 15. Topic: Legal and compliance issues in medical scribing. A scribe is documenting a patient visit and accidentally records incorrect information in the ER. What is the correct way to correct an error in a medical record? A. Delete the incorrect information and replace it with the correct details. B. Strike through the incorrect entry, add an addendum, and date sign the correction. C. Leave the incorrect entry as is and make a mental note to mention it to the physician. D. Ask another scribe to modify the entry to avoid personal liability. Answer: B. Strike through the incorrect entry, add an addendum, and date sign the correction. Explanation: medical scribes must not delete medical records but instead document corrections transparently to ensure compliance with HIPAA and legal standards. Question 16. Topic: Medical documentation and HIPAA compliance. A medical scribe is documenting a patient encounter when a nurse from another department asks about the test results of a patient not under her care. What should the scribe do in this situation? A. Provide the requested information, as hospital staff have access to medical records. B. Only share the information if the nurse signs a confidentiality agreement. C. Politely refuse and remind the nurse about HIPAA privacy regulations. D. Print the records and hand them over for review. Answer: C. Politely refuse and remind the nurse about HIPAA privacy regulations. Explanation: under HIPAA, Health Insurance Portability and Accountability Act, only individuals directly involved in a patient's care have the right to access that patient's medical information. Unauthorized disclosure can lead to legal penalties. Question 17. Topic: Electronic health record. A. Best practices. A physician dictates a patient note but later realizes the chief complaint was documented incorrectly. The scribe needs to correct the information in the error. What is the most appropriate method for correcting the error? A. Delete the incorrect information and enter the correct one. B. Use an addendum noting the original error, correction, and date of change. C. Ask the physician to modify the information without documentation of the error. D. Replace the incorrect note and leave no trace of the original entry. Answer: B. Use an addendum noting the original error, correction, and date of change. Explanation: in medical documentation, errors must be corrected transparently. Addendums allow accurate record keeping while maintaining legal compliance. Deleting records is not allowed under HIPAA regulations. Question 18. Topic: Cardiology and emergency situations. A 56-year-old male arrives at the ER complaining of substernal chest pain radiating to his left arm, diaphoresis and nausea. An shows segment elevation neuromentomen F. What is the most likely diagnosis? A. Anterior myocardial infarction, MI. B. Inferior myocardial infarction, MI. C. Pulmonary embolism. D. Aortic dissection. Answer: B. Inferior myocardial infarction, MI. Explanation: since segment elevation neuromentomen F indicates inferior wall MI, typically caused by an occlusion in the right coronary artery, the CA, rapid reperfusion therapy is required. Question 19. Topic: Pulmonology and oxygen therapy. A 68-year-old male with COT presents with severe dyspnea and hypoxia, C-walls 85%. The physician orders oxygen therapy but warns against excessive oxygen administration. Why should high-flow oxygen be avoided in this patient? A. It can cause oxygen-induced hyperventilation. B. It may suppress the patient's hypoxic respiratory drive. C. It leads to rapid bronchoconstriction. D. It worsens metabolic acidosis. Answer: B. It may suppress the patient's hypoxic respiratory drive. Explanation: COPD patients rely on hypoxic drive to stimulate breathing. Excessive oxygen can reduce respiratory effort, leading to co-retention and possible respiratory failure. Question 20. Topic: Neurology and stroke protocols. A patient arrives at the ER with right-sided weakness and slurred speech. A non-contrast CT scan rules out hemorrhagic stroke. The physician considers thrombolytic therapy, EPA. What is the primary eligibility criterion for administering TPA? A. Stroke symptoms present for over 24 hours. B. Symptoms began within the last 4.5 hours. C. History of intracranial hemorrhage. D. Patient has uncontrolled hypertension, a P220/100 throatometry. Answer: B. Symptoms began within the last 4.5 hours. Explanation: Alteplase TPA is only administered for ischemic stroke within a 4.5-hour window to minimize hemorrhagic complications. Contraindications include recent bleeding, severe hypertension, and history of hemorrhagic stroke. Question 21. Topic: Endocrinology and diabetes management. A 45-year-old woman with type 1 diabetes presents with confusion, sweating, and tachycardia. Her blood glucose level is 42 ddL. What is the most appropriate initial treatment? A. Administer insulin to stabilize blood sugar. B. Provide 15 grams of oral glucose if the patient is alert. C. Give an immediate Roman infusion of 5% dextrose. D. Advise the patient to eat a high-protein meal. Answer: B. Provide 15 grams of oral glucose if the patient is alert. Explanation: this patient has hypoglycemia requiring rapid glucose administration. If the patient is alert, oral glucose is preferred. If unconscious, Roman dextrose or glucagon injection is used. Question 22. Topic: Pharmacology and drug reactions. A patient presents with rash, facial swelling, and wheezing after taking penicillin. The physician diagnoses anaphylaxis. What is the first-line treatment? A. Intravenous diphenhydramine. B. Intramuscular epinephrine. C. Oral prednisone or Romanil saline. Answer: B. Intramuscular epinephrine. Explanation: anaphylaxis is a life-threatening allergic reaction requiring epinephrine 0.31 concentration. Antihistamines and steroids are adjunctive therapies. Question 23. Topic: Trauma and emergency medicine. A 30-year-old male is brought to the ER after a motor vehicle accident. He has hypotension, jugular venous distension, and muffled heart sounds. What is the most likely diagnosis? A. Tension pneumothorax. B. Cardiac tamponade. C. Aortic dissection. D. Pulmonary embolism. Answer B. Cardiac tamponade. Explanation: the Beck's triad hypotension JVD muffled heart sounds suggests cardiac tamponade, often due to pericardial fluid accumulation. Immediate pericardiocentesis is required. Question 24. Topic: Orthopedics and fracture management. A 12-year-old boy falls and sustains a midshaft humerus fracture. On examination, he has wrist drop and inability to extend his fingers. Which nerve is most likely injured? A. Ulnar nerve, B. Median nerve, C. Radial nerve, D. Axillary nerve. Answer: C. Radial nerve. Explanation: midshaft humeral fractures can injure the radial nerve, causing wrist drop due to loss of extensor function. Question 25. Topic: Pediatrics and infectious diseases. A 3-year-old child presents with barking cough, inspiratory stridor, and hoarseness. The physician suspects croup and orders a neck X-ray. What characteristic finding is expected on the X-ray? A. Thumbprint sign, B. Steeple sign, C. Ground glass opacity, D. Honeycombing pattern. Answer: B. Steeple sign. Explanation: croup laryngotrachobronchitis causes subglottic airway narrowing, seen as the steeple sign on X-ray. Question 26. Topic: Medical documentation and legal considerations. A medical scribe is documenting a patient encounter when the attending physician accidentally misidentifies the patient's past medical history in the note. The physician asks the scribe to delete the incorrect information from the AIA and replace it with the correct history. What is the most appropriate action the scribe should take? A. Delete the incorrect history and replace it with the correct information. B. Use legal addendum to correct the information and document the update. C. Leave the incorrect history as it is and let the physician explain it later. D. Modify the note without any indication of change as per the physician's request. Answer: B. Use a legal addendum to correct the information and document the update. Explanation: medical records cannot be altered or deleted. Instead, any corrections should be made using an addendum, which notes the original mistake, the correction, the date, and the reason for the change. This ensures legal and ethical compliance with HIPAA and medical documentation standards. Question 27. Topic: Cardiology and interpretation. A 65-year-old male presents to the emergency department with acute shortness of breath and dizziness. His ECG reveals irregular S complexes with an absence of P waves. His vitals show a heart rate of 130 bpm and blood pressure of 165 mmHg. What is the most likely diagnosis? A. Atrial fibrillation, B. Ventricular tachycardia, C. Third-degree heart block, D. Sinus bradycardia. Answer: A. Atrial fibrillation. Explanation: atrial fibrillation (fib) is characterized by an irregular rhythm and the absence of P waves on an ECG. It is a major risk factor for stroke and is often treated with rate control, beta blockers, or calcium channel blockers and anticoagulation to prevent thromboembolism. Question 28. Topic: Endocrinology and diabetes management. A 58-year-old female with a history of type 2 diabetes mellitus T2M is brought to the ER with altered mental status, dehydration, and blood glucose of 604 mg/dL. Arterial blood gas analysis shows EUR 7.37, normal anion gap, and no ketones in urine. What is the most likely diagnosis? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hypoglycemic state HS. C. Lactic acidosis. D. Septic shock. Answer: B. Hyperosmolar hypoglycemic state HS. Explanation: HHS is a life-threatening complication of type 2 diabetes characterized by severe hypoglycemia, 600 mg/dL dehydration, and altered mental status without ketones or acidosis. It differs from DKA, which typically occurs in type 1 diabetes and presence with ketosis and metabolic acidosis, low pH. Question 29. Topic: Gastroenterology and emergency medicine. A 47-year-old male presents with severe epigastric pain radiating to his back. He has nausea, vomiting, and a history of chronic alcohol use. His serum lipase is 5 times the upper limit of normal. Which of the following is the most likely diagnosis? A. Acute cholecystitis, B. Acute pancreatitis, C. Peptic ulcer disease, D. Gastroesophageal reflux disease. Answer: B. Acute pancreatitis. Explanation: acute pancreatitis is characterized by epigastric pain that radiates to the back, elevated liposamylase, and is commonly caused by alcohol use or gallstones. Treatment includes fluid resuscitation, pain control, and supportive care. Question 30. Topic: Neurology and emergency stroke care. A 72-year-old woman with a history of hypertension and atrial fibrillation presents with sudden onset left-sided weakness and slurred speech. CT scan confirms an ischemic stroke. The physician is considering thrombolytic therapy (EPA). Which of the following is an absolute contraindication to EPA administration? A. A stroke that began 2 hours ago. B. Blood pressure of 175/95 mmHg. C. History of ischemic stroke 2 years ago. D. Recent gastrointestinal. E. Bleeding within the last 2 weeks. Answer: D. Recent gastrointestinal. E. Bleeding within the last 2 weeks. Explanation: thrombolytic therapy (EPA) alteplase is used for acute ischemic stroke within a 4.5-hour window. However, it is contraindicated in recent major bleeding events such as bleeding, intracranial hemorrhage, or recent major surgery due to high bleeding risk.